Hi, thanks for having me. I've been traveling and speaking a lot, and I've gotten to where I start off by saying that I shouldn't be here. That we have decided to say this is what we do, and here's how much it is novel in healthcare is an indication of just how awry things really have gone. I'm really excited though because there are a lot of developments that point to just exactly what Jay and Maria said, that this cat is out of the bag. This transparency in healthcare cat's out of the bag, and there's really not any stopping it. And I think the more that the federal government with their scams like the Unaffordable Care Act, the more they clench their fist and try to get control, the more paradoxically they will create and are creating a consumer-driven market. Many of the deductibles that I saw in some of the exchange plans were high enough that people could pay completely out of pocket for the procedures that we have listed online. So as people have more and more out-of-pocket exposure, I think that that they ask, they're spending their own money, and they ask the same question. People spend their own money, want to know how much does it cost, and they want to know that up front. And the facilities, the physicians that respond to that, they're going to do well, and they're going to just be very busy, and we're already seeing that at our place. The facilities that don't are going to see patients walk out of Austin and Houston and all over the place. I think more and more facilities though will see patients with a plane ticket in one hand and our prices in another, or McBride Clinic Hospital's prices, or Oklahoma Heart. And we'll see more and more leveraging of better deals. And physicians, I know this, they tend to respond to fear more than anything. And it won't take 10 cases that an orthopedist or a urologist or a gynecologist has lost to a facility like mine before they start to scream at their local community to, the facilities to respond to this. It's very scary for these physicians and facilities to lose business to us. Somebody the other day asked me, when am I going to open up a facility in New Jersey? And I told them I had no plans to open up a facility in New Jersey. I didn't have to, that there were plenty of people from New Jersey coming to Oklahoma City. And they said, well, our company is self-funded, and we need a facility like yours in New Jersey. And I said, well, all you have to do is send 10 of your employees to Oklahoma City for surgery and just make absolutely sure that the other facilities in New Jersey know about it. And poof, presto, you'll have a Surgery Center of Oklahoma sort of arrangement there very soon. But the market does work. It's much more powerful than anything that the goons and the federal government can come up with their schemes. And it is going to and is creating a real deflationary move in healthcare here in Oklahoma City and really all over the country. And that's really the soft underbelly of the beast of the Unaffordable Care Act. The government is attempting, I think most people agree now, to create a crisis. I call it a medical false flag. And they want to see deductibles and health spends go through the roof. So there's a crisis, and then they can ride it on their white horse and rescue us with single payer. But if the prices are falling like they are here in Oklahoma City, colonoscopy, endoscopy procedures at digestive disease specialists are a tenth of what they are at many of the local hospitals. Those local hospitals, they're going to have to respond to that, and the prices are going to fall all over the United States. And then people will be scratching their head, and they'll think, well, wait a minute, I need to think about my whole insurance thing differently. I don't know that I even need insurance, or maybe I need a catastrophic policy. What role does the government have in healthcare? And I think all these are going to be questions that are entertained that should have been. And finally, we'll begin to address the issue of cost. And people will begin to understand, as Jay and Marie and I know now, that there's actually an inverse relationship between cost and quality, which is very interesting. We are expanding at Surgery Center of Oklahoma. We have 2 operating rooms that we are making plans to add on, which will allow us to do We think around 1,500 surgeries a month, which would make us probably the largest surgery center in the United States. We're seeing a lot of patients from Alaska and Massachusetts and California and just all over the United States now.
Massachusetts. How can that be?
Well, the Romney Care is fully implemented.
That's right.
And some of the most expensive health care in the United States definitely coming out of Massachusetts. We're just now beginning to see more local interest, which is interesting. There's a lot of inertia with self-funded companies in Oklahoma. Jay and Maria deserve a lot of credit for stepping out of the box because they're really the pioneers in the self-funded side to make this happen. But it's interesting in Oklahoma, there's a lot of inertia, and the companies locally that are self-funded are just now beginning to come along, farther behind their counterparts in other states. We are excited about the addition of a full-service hospital to this, what I call brotherhood of price transparency embracers, and Deaconess Hospital is definitely going through those initial pains of, okay, let's look at our cost and add a marginal profit and come up with some prices in that way. And I'm working very closely with them. And one of the most exciting things about their being involved is that this whole lie that, well, that's all well and good for Surgery Center of Oklahoma, they can do that, but the big hospitals can't do it. Well, there's one that is doing it, and so that just doesn't hold any water anymore. We're planning a symposium this spring that probably is going to happen here in Oklahoma City. All of the people that are interested in this price transparency movement, they would be coming here from all over the United States with speakers, and it's in an attempt to fan the flames and make sure that this movement continues. We are honored that you all have the trust in Surgery Center of Oklahoma and of our medical staff. They're our favorite patients, the ones who travel from far off, who have shopped and know the difference. They tend to be the most grateful patients that we take care of. And we've thoroughly enjoyed working with the Kempton Group and the Vantage Health Plan.
Thank you. Yeah, it's been a great relationship, and talk a little bit about the Texas bankers. We've had I think it's this month's IBAT magazine. There's there's an ad in there, which is actually, I don't know if you've even seen it, but it's two of your patients from Texas that came up, and IBAT featured them and their story, and they're both
good.
from Groesbeck. One of them is June, so
Yes.
June Wiskowski.
Yes.
So. But anyway, those are examples, and of course, I'm sure they wasn't high on their priority list to have to go all the way to Oklahoma, but their expectations were we're blown away as far as the quality and the relationship. And what we always like to tell people that when you start stripping out some of the layers of the healthcare transaction, where it's between that willing seller, the facility, and the willing buyer, which is the patient or the patient's health plan, and strip out a lot of those layers, the patient experience improves dramatically. And you've talked about this, and some of the other premier providers have talked about this, is that hey, if I've got a cash paying customer that's coming in the door, I feel like we are competing for that patient, and we know that they have chosen our facility based on competitive forces and based on some research, and trying to meet that expectation. That's how you get repeat customers. That's how our community banks, that's how you all operate. It's how we operate here at the Kempton Group. And so, healthcare providers and facilities for a long, long time have felt like that wasn't really their gig, and they didn't need to do that.
That's right. We like to earn the business that we get. I don't want to have a full waiting room because we're signed up with some plan.
Right.
I want to have a full waiting room because we've earned the trust and respect of the prospective patients.
Yeah.
And it's a little different way of thinking about it.
And that's a great point. Some of the facilities and just people that are in my industry, everybody is, and you and I have talked about this quite a bit, but everybody, not everybody, but a whole lot of people are always trying to figure out how do they own the free market. How do I turn what's happening here organically between that willing buyer, that willing seller, that free market? How do I turn that into a product that I own and I can charge admission for? And as we say, it's like they're trying to drag the free market back into a closed market. They're trying to have opaque transparency where they're selling a ticket to admission, and it's something that we have to fight all the time. That if we want to sell access to good pricing or to providers, we're going to end up right back where we're at today, because that's what has screwed up healthcare for so many years. But,
And we want everybody to do this.
Yeah.
I mean, I welcome competitors, and that's why we did this, so we could
Sure.
introduce some competition
Market
in
forces,
healthcare.
you bet.
Absolutely.
Dr. Smith, I know before we let you go, I know you want to address why Consumer Reports didn't rank you.
Oh, there's a couple of reasons. One, they hit hospitals, and we're a surgery center, but the main reason is we don't take federal money, and all the data is based on Medicare cost reports. And I stopped taking federal money in 1992 and just decided I'd rather treat Medicare patients free than to take money from my neighbor for care I gave someone across town they didn't even know. So we've never taken a dime since we've opened in 16 years of federal money, and so Medicare, they don't even know who we are. So we've never appeared in any of those reward programs or designations. The McBride Hospital and the Oklahoma Heart Hospital, I know firsthand, are deserving of much more of an honor than Consumer Reports gave them. They really are just phenomenal facilities.
And I'm sure there's a lot of them in Texas as well, and they just need to come forward and embrace this, and eventually they will. Dr. Smith, thank you very much for your time.
Thank you, guys. Appreciate it. Thank you all.